short. I thought from the outset, on behalf of BRC, we should be thanking Prashant and Sandeep for all that they are doing for us. It's very important, and you should all know how important all these sessions are for us, because they are the ones who introduced this kind of fitness regime to Ballari. Because I remember doing this session with one of their coaches, Mr. Shreyas Karnad, I think it was in 2016, around 7 years ago. And at that time, we did it in KRS function. I don't know, most of you must have attended that initial days. And on that day, he literally, the muscles were all sore by the time we got back home, because he made us do so much, and he did those roller things on the muzzle, and the muscles were literally sore. You couldn't even touch the muscle. That kind of stretching exercises, that kind of exercise that he did for us. There's a video. I think we should all revisit that video, because that will tell us how important all these things are. The reason why I wanted to take this short session is mainly because all of you are doing excellent, all of you are progressing well in your running and whatever. But please give a thought, and please give a thing or two to your muscles, to your joints, to your bones, to your whatever. That's more important, because we always keep telling about the core, the glutes, these kind of things. We should know. So I thought, let us take a session on what kind of muscles that we are activating, what kind of muscles that we are trying to do, what kind of muscles that we are trying to build, and why it is important to build such muscles for us to keep running, to keep moving. I'm sure all of you must be walking, doing some sort of exercise in your home. Walking is an habit that we have got right from our birth. Running is completely different from walking. Our body is not made to run, our body is made to walk. Otherwise we would all be running every day. The body is so malleable that we can always do whatever you want with your body. You have to train, that's it. You have to train yourself to make sure what you want to get out from your body. And running is much different from walking. That's the reason why you are doing all these things. So for that, let us know a bit of what we call as anatomy of our body. So I'm sure all of you know about the joints, about all the joints that are there in the body. The wrist joint, the elbow joint, the shoulder joint. Why it is important is because every joint is involved when you're running. You should not think that only the legs are running. And even the motion of the hand, the swing, the initial swing, the gait, stance, everything is important. So these are the joints and the muscles involved. All of you must know. This is the deltoid. All of you must have got the COVID vaccination that is in the deltoid. Yeah, this is the triceps. This is the biceps. All of you know about the biceps, the triceps. Push-ups, that will increase your biceps and the triceps. So your dumbbells will increase your biceps. And then you got the chest. It's called the pectoral muscles. Yeah. Then you got the abdominal muscles. This is called the rectus abdominis. That is, the rectus is one which will hold the abdomen. And then you got the erector spine. This is the erectors. That's the reason that is make sure that you are erect. So that's why something is gone. If you are sore, you tend to lean like this. You tend to bend. So it will not keep you erect. So you want to be erect, that's erector abdominis. Then you got erector spinae, the spine. The main thing here is the erector spinae. Then you've got this is the shoulder muscle. Yeah. Then you've got the glutes. That's most important, the glutes. That's the maximum, that's the bulk of the muscle is the glutes. That's the gluteus maximus. Then you've got also called as the gluteus medius and the gluteus minimus. And the glutes are the important muscles of the body, which will keep you, make sure that your posture is important. It will keep your posture important. Then you've got the adductors, the ones which are inside, this is adductors. Then you've got the quadriceps. Then you've got the hamstrings. These are the hamstrings, the back ones. And this is the calf. And this is the tibialis anterior, the one in the front. That's the tibialis muscle. All these muscles are put into use when you are running, when you are walking. So that's the reason why they give importance to all these muscles. They're pulled. So glutes, push your glutes. That's the reason why. Because glutes are the most important muscle when you are running and when you are walking, whatever. To keep your posture, glutes are very important. So the reason why we need to understand all these mechanisms, the biomechanisms, is because when you are running and walking, two different ball games. The walking, there's the gait stance. It's important that you maintain your gait because you need to make sure that your body weight is proportionately distributed. So you should not stand on one leg, you should not stand with your posture like this. So it's important that you maintain a posture so that you distribute equally you stand on both the legs. Make sure that all your muscles are tight. That's more important because that will make sure that you don't tweak your muscles, you don't pinch your muscles anywhere, and also your muscles are always in motion. So once you don't activate your muscle, then your mobility will get disturbed. I'm sure all of you know that if you don't use your hand for a while, when you start moving your hand becomes painful because you're not putting your hand into action. Same thing with any muscle. If you don't use it, then you get pain. That's the reason why you should keep using your muscles, keep making sure that your muscles are mobile. I'm sure all of you are doing this, but it is important because when you get injured, that's when you realize how important it is to make sure that you put all your muscles into action. Make sure that all your muscles are in the right place and they're not having any injury. And the reason why you need to do this kind of exercises or these mobility exercises is building up your muscles. The core muscles, you can't imagine, there are 39 core muscles. When you say that you build up your core, it is you're activating 39 muscles. So that's kind of muscles that you're activating when you do your core. There are many muscles. I'm just telling you the muscles which are really apparent, which you can see, but there are so many muscles inside. For example, the groin. I forgot to tell you about the groin. It's most important. It's called the iliopsoas muscle. All of you must have seen that, groin injury. You must have heard about the groin injury. That is the iliopsoas muscle. You can feel that muscles. All these muscles you can feel. The iliopsoas is very important because they are the ones which will keep your upper body and the lower body in control. The iliopsoas. So that's the core. So if you injure your iliopsoas, you can see that you will start limping. The pain here, you will start limping. So it's very important that you keep all these muscles in motion and action. The biomechanics involved is basically, it will tell you how, there are 5 components to it basically. There's the motion. Motion is whatever moves in space is motion. Your body moves in space is motion. Then you need the force to move. All this activates your muscles. They'll say, load your legs. You can see what they're telling because why it's important. You load your legs. The loading is basically telling you that when you put your weight on the feet, that's called the loading. That's the gait stance. That's the gait. How you run is also called as the first load. That's more important. You put pressure on one leg. Then you got the momentum. Then you need to pick up the momentum. That will tell you the speed, how speed you go. Then you got the lever. The hands act as a lever. And then basically the balance. You need good balance. You'll say balance. So you think when you start thinking, you'll know how important they're telling, what important things they're telling. So they're telling you balance. The reason why is because you need all this to ensure a good gait and a good run. So all these things are important. These are the 5 components of a run. So when you do a stance, the gait stance, this is one gait stance. That is when you start walking, you put your foot on the ground, 1, 2, and you come back to it. That's one gait stance. Most important thing is when you're doing it, when you're doing this, when you put your load your leg on one, that's a first part of the stance, the gait. Then when you start raising your heel, you start heel rise, that's the mid stance. Then the toe off. You need a momentum to go forward. That's the toe off. That's the heels toe off. You take your toe off the ground. So they are the different. Then you have the swing, the arm swing, initial swing and the terminal swing. So all these are in coordination. All this is important. The mid stance. The basic difference between walking and running is, in walking, both your feet are on the ground all the time. All the time both your feet are touching the ground. But in running, there's a fraction of a second where you float, double floating is there. So that's the reason why you need a good strength, you need a good balance, because once you start running, your center of gravity keeps falling down. So to make sure that you are up, you should make sure that you are up. So you need good core strength. That's the reason why you need good core strength, because you don't want to fall down when you're running. So you need a good core strength to make sure that you are up, your rectus spinae is good, rectus abdominis is good, all these erector muscles are good. So that's the reason why they give a lot of importance to all these exercises, because it will make sure that you don't fall down, you are balancing, you don't injure your muscles because you are doing a wrong step. So many things are involved, because when you are running, you need all the joints. These are so many joints that are involved: the hip joint, the knee joint, the ankle joint. They'll tell you, open up, because you're trying to open up your hips, because these are the glutes are the most important muscles of the running. Because that's the reason why they tell you, open up your hips, make sure that your hips are open, because that's the reason why you need to uh, put your glutes into action. So before any running, the reason why they tell you, make sure that you warm up, because you have to do some sort of mobility exercises. Mobility exercises are the ones which will kickstart your muscle, to start going into motion. So if you don't do that, then you're obviously giving a chance for the body to get injured. So you should not do that. So injury free, you should make sure that you know what joints to activate, you know what muscles to activate. Make sure that you activate those muscles and then strengthen those muscles and then start running. So it's not just get up, start running. And what sessions they're doing, I think we should all get it done at home again sometime during the week. Otherwise, what will happen is the gap is too much. The muscle we need to keep on doing things. Repetition is very important. Otherwise, will not give that necessary strength to the muscle. So it's not just strengthening, it is mobility, it is also trying to get your balance, so many things, so many aspects. So it's not just strengthening. So here what we are doing is probably everything. We are trying to do some balance, we are trying to do some mobility, and we are also trying to get the strength to the muscles, different muscles. So the most important thing in any sessions that we need to learn is make sure that understand what is the mechanism behind it, why they are telling it. I'm sure sometimes they might be going very fast. I think I tell them to slow down, because if you don't do the sessions in the right manner, then your chances of injuries are more. That's the reason why they say get it right. The reason why you want to get it right is we need to make sure that you don't get injured, because even if you don't do it properly, for example, if you don't do a certain, say for example, pigeon pose or whatever, if you don't do it properly, then you can probably injure your knee joint, or you might injure your ankle joint also. Then you'll start getting that ankle joint starts hurting, and then you'll stop doing things altogether. So it's important that you get the right posture, the right you take time to do it. For example, the other day you were doing that dumbbell, the kettlebell with go back, jump. So if they don't do it well, then you will definitely injure your IT band, so many muscles get injured, because they're doing it every day, or maybe at least three times a week. When we're doing it once a week, then your chance of injury is more. So it's important that we repeat at home also, and make sure that you reduce your chances of injury. The most other thing that we need to learn is, for example, if somebody is having a back pain, the back pain may not be because of the back. The back pain might be because of the hamstring. You might be thinking, what is it talking? Because there is something called as the muscles will get attached to the bone. Muscles will get attached to the bone through something called as tendons. Okay, so that's how the bone and the joints act. Okay, because the muscles get attached, and then you have the contraction and relaxation. The hamstrings, they form part of the core. I'm sure you all know about the core now. The hamstrings, the glutes, the quadriceps, they all form part of the core. Suppose if the hamstring is tight, then there can be a back pain. So that's called as a referred pain. So if you have a pain in the knee, it is not the knee joint that's a problem. So remember that. It may not be the knee joint. It is probably the muscle which you are not activated, you are not strengthened your muscle. Because when you're running, you give a lot of, there'll be, it is not just because you'll be jarring your knees. So there'll be the impact is more on the knees, impact is more on the ankle joint. So the muscle above should be very strengthened. Otherwise, you'll have knee injury. So if you have got a knee pain, it is not because of the joint, it will be because of the muscle above. Similarly, if you got a problem with the spine or the back pain, it could be because of the weak glutes or it could be because of the weak hamstrings. So you should know that there is something called as a referred pain here. So similarly, if you have got a problem with your glutes, you can have pain in the iliopsoas, the groin pain. So the reason why you should understand the mechanics of it, which muscle will act what. So if you understand, once you understand the mechanics of it, then you'll start doing things better. That's more important. If you start doing things more scientifically, then the injuries is less. Otherwise, you will be more prone for injuries. So I thought let us give a brief introduction. I don't know.
Nice one, sir.
Know what is wrong. Have an injury-free run. That's more important. Enjoy your runs, but make sure that you're injury-free. And of course, there's a lot other things. You should take care of nutrition, hydration, so many things. It's just one aspect, but we can't thank Prashant and Sandeep enough because they introduced us to all this. Because we did not know. I mean, we are definitely much better than others because we at least know a thing or two about running, about fitness, about strengthening, about core. I mean, we are very fortunate to know about all this. And at least we know that they were doing something extra from the routine that what we do. All of us are busy in our own profession, in our own work. But something extra, take your time out and do something extra apart from what we all do. So I thought most of you must be knowing Ajay, Sundar sir, everybody must be knowing medicine stuff, but I thought let me introduce you to other people who are here to know what kind of muscles that we are trying to activate and what kind of muscles we are trying to know when we are running, walking and all that. The stance is very important. All of you, I don't know, all of you even during your day-to-day life, day-to-day practice, make sure that you stand on both the legs. Never use one leg to stand. Again, because the distribution, the weight distribution, the gait distribution, everything will get haywire. So it's important that you stand on both the legs. Make sure you maintain a good posture. That's more important. I always see Murli always on one leg. He does half marathons. He's not here. I wanted always to tell him. You keep seeing his photographs. He's always on one leg. He's like this. He's never like this. But he does 21K. That's different. But it's important that you maintain a good stance so that you don't injure your muscles. You don't injure your joints. So many things.